What about physical activity in Ramadan? What do we advise our patients to engage in? Okay, so we do encourage to maintain a physical activity in Ramadan. We, however, avoid rigorous exercise during the final hours before we break our fast, because that's we'll have stayed the longest without food by that time. So when longest, we advise our clients not to partake in rigorous activities. We also need to advise our patients on concerns of hypoglycemia and dehydration. So while we exercise, we perspire, we lose fluids. So there is a concern for dehydration. When we engage in rigorous physical activities, we burn calories. So there does exist a risk and concern of hypoglycemia. Night prayers, Muslims do engage in nightly prayers after they break their fast. It ranges from 8 rakats to 22. So it is a form of physical activity, and it can be encouraged. Okay. Ah, what about adjustments of medication as an entity in pre-Ramadan assessment? Uh, I can speak from the outset that on as concerns oral hypoglycemic agents, tablets used to lower blood sugars, most of them are pretty safe to use during Ramadan. Most of them don't carry a great risk of hypoglycemia, of lowering your sugars. Most of them might be used without much adjustments. However, a class of oral hypoglycemics by the name of sulfonylureas needs to be approached with caution, and adjustments do need to be made for our Muslim patients who opt to fast during the month of Ramadan. So sulfonylureas and a class of medication termed as SGLT2, SGLT2 inhibitors, okay? Those carry a different kind of risk of dehydration and low blood pressure. So I don't wish to spend a lot of time in medication adjustment. I'll just fly through these slides, okay? So metformin, hypothetical, there's no concern for hypoglycemia, and the dose may not need to be adjusted during Ramadan. A safe medication during the Ramadan. Acarbose, we hardly use it in our part of the globe, at least in Kenya. Short-acting insulin secretagogues, these are medications that for a brief period stimulate pancreatic release of insulin. Again, not popular medication in our part of the world. And there is a theoretical concern for hypoglycemia, but there are no studies that back up that theoretical concern. And medical practitioners do prescribe it during Ramadan without much dose adjustments. Now, this is the class of medications of interest. So sulfonylureas, these are insulin secretagogues. They promote insulin secretion from the beta cells of the pancreas. And we know insulin is hypoglycemic. So if any drug stimulates release of insulin, there does exist a theoretical and a clinical concern for hypoglycemia. So what we have in Kenya, glibenclamide and gliclazide, okay? Glimepiride also is in the market. So how do we approach sulfonylureas? So if a patient is stable, has good glycemic control, HbA1c at target, and they are on a sulfonylurea and metformin or other class of medication, we can safely stop the sulfonylurea for the period of Ramadan. Again, for individuals who are at target, they are at optimal glycemic control, we can opt to altogether stop the sulfonylurea for the period of Ramadan. Those that are not in optimal control, we can adjust their doses of sulfonylurea. If they're using a once daily dose of sulfonylurea. They can opt to take that dose with the largest meal during Ramadan, which is iftar. Okay, so you can opt to use the same dose during iftar, again with close monitoring of sugar. I will be talking about dose adjustments, reduce this by this percentage, half this, do this in this time. All these are recommendations. They do not work without self-measurement of blood glucose at home. These are merely recommendations. We might adjust, we might slash our doses, but they can only work well in tandem with tight monitoring of blood glucose at home. Okay, so in the event that an individual uses a twice daily dose of sulfonylurea, we opt to use the larger dose with the larger meal which is iftar, and the smaller dose at suhoor, the lighter meal. If it is an equivalent, if it is an equivalent dose of the SU, we can use the unchanged dose at the largest meal, which is at iftar, and halve, reduce by 50% the suhoor dose. Okay, the larger dose with iftar, we can have the the second dose with suhoor. All this in an attempt at minimizing the risk of hypoglycemia. Okay, TZDs, no much risk for hypoglycemia during Ramadan, and they can be safely used without much concern. Okay, SGLT2 inhibitors, this is a new class of medication that has gained popularity late. Aids in renal protection, cardio protection, and basically all your arteries, name them. Okay, so stroke prevention, cardiac, renal, and numerous studies to attest to the same. Okay, so risk of hypoglycemia is quite low, very, very low. However, based on the mode of action of these molecules, there is a risk of hypertension and dehydration. So how do these molecules work? So these molecules promote diuresis of loss of glucose with urine. It promotes loss of glucose with urine. Okay, so you lose glucose, you lose excess glucose. So when you overcome the renal threshold for glucose, you pass out glucose. So these molecules promote the loss of excess glucose through urine. So as you lose glucose with urine, you pull water through osmosis. So you pull water with your lost glucose in urine. So you are losing your glucose and you're pulling water from the body with you through urine. So you're losing water and you're losing glucose. So there arises the risk for dehydration. And as you lose your fluid volume, there's a risk of hypotension as well. So which individuals are at greater risk for dehydration and hypotension while using this medication? People on diuretics, medications like classics which promote fluid loss. So these medications further compound the risk of hypotension and dehydration. Elderly individuals. So we know that the elderly really shy away from fluids. They hardly drink. If they do, it's just a little amount. So elderly individuals on these medications and intending to fast need to be cautioned on the risk of dehydration and hypertension, blood pressures dropping too low while on this medication. So we advise these individuals to drink at least 2 liters of water in between fasts, okay? Just to offset the risk of hypertension and dehydration, okay? There does exist a concern for diabetic ketoacidosis with this. Nam, yes?
Just to give you a short break, maybe
Hello?
we can ask participants if they have any question.
Or at this point? Sure.
Yes, can we invite the participants
Sure.
so that you can have a short break?
All right. Since you're inviting me for a break, sure.
Yes, so participants, anybody with a question so far? I think the explanation from Dr. is very elaborate, but we welcome questions so that we want to make this session interactive. So feel free to unmute and ask a question.
Dr. If somebody is on SGLT2 prior to Ramzan,
Yes.
what are we supposed to do when he faces the Ramzan then?
Okay.
He
Again,
wants to fast.
okay. Remember, we start engaging our patients 6 to 8 weeks prior to Ramadan. Okay. So once you engage your patients early on, this is literally you are doing a test drive, a pre-run to a mock Ramadan. Okay. What we usually do, we advise our patients. There are usually optional days Muslims can fast, days of Mondays and Thursdays. These are days a Muslim can opt to fast. So what we advise our patients, you are on your current medication, you are on your sugar monitoring devices, please attempt fasting on your current medications, and we observe if there are any potential risks of you fasting. So during this pre-run period, before Ramadan, it is a time to catch any of these concerns, any of these risks we've been talking about. So if any risks become apparent, then this is a period to address them. So we usually do not advise our patients to stop their SGLT2 medication. These drugs are phenomenal. These are drugs that have found use beyond diabetes. Cardiologists prescribe this medication, nephrologists prescribe these medications, neurologists prescribe this medication. These are wonder drugs. So we really do not wish to stop these drugs in any of our patients. So during this pre-run, during this pre-Ramadan assessment, okay, we pick up any concerns, any risks, and address them. So if we do notice that our patients run the risk of dehydration and hypotension, this is the time to advise them to up their fluid intake. So 2 liters, 3 liters. We advise them to do that, then we see, have we mitigated this risk of dehydration and hypotension or not? Okay, so in most cases, yes, this is sufficient for them to address this. Okay, and when we prove that it is safe to remain on these medications with just a slight increment in fluid intake, then we grant our patients permission to enter Ramadan on their current medications.
Thank you very much for that response, Dr. Any other question? So can we go ahead?
Sure.
Any other questions from the participants? Doctor, I think we can go ahead.
Okay, all right. GLP-1 receptor agonists, these are injectables medication. They are also gaining popularity in Kenya. They're used for both lowering of blood sugar and also for weight loss. Okay, and these can safely be used in Ramadan. Now, getting on to insulin, like I mentioned earlier, and as we saw in that risk calculator, what type of medication are you on? And the biggest cause were for sulfonylureas and insulin. Okay, and insulin, it matters what type of insulin are you on. Are you on a simple regimen of just once daily basal insulin, or are you on a twice premix insulin regimen, or are you on a basal bolus insulin regimen involving 4 and more injections? So all these are different risk categories. Okay, So individuals